There's two at the health bar right now, two very fine, strapping young men. What's happening today, Gerald?
How long has it been since you've been called a jock, Gerald?
Well, I'm wearing my black jocks today.
Oh, hello.
So, look, if you really want to know. But thanks to us. And what it's doing is obviously now a good emphasis on prostate health. And it's important from what we've learned so far that we need to be much more open about discussing the health issues around prostates.
Mate, you are so right. Talking about your prostate can be a little uncomfortable, and a lot of guys don't even know where it is, and they think that it actually is just to do with older guys. But should I be strapping on a bit of a rubber glove? Is that what this segment is about?
You will be relieved, Heinzie, to know that that's not done all that much these days. So there's a very simple blood test that you go along and you can have, but that's more for a PSA test, which is more an indicator of prostate cancer risk. But what we need to understand, the gland is there. This is
what is it?
A gland that sits beneath the bladder, and it's there to excrete fluid to help semen flow. So that's its function. It's a fluid-producing gland. The problem is that as we get older, it increases in size. That's the challenge.
So what can cause it to become bigger?
We all carry testosterone, and that is converted to another hormone called dihydrotestosterone. So that conversion into dihydrotestosterone causes prostate cells to replicate far faster than normal. We see that in issues like more frequent urination at night, an inability to actually completely empty your bladder, to a difficulty in starting and stopping. So these are issues that are lifestyle issues. A lot of blokes just say, oh, look, it's just that, but it does involve
these symptoms don't sound quite right, and if anyone was experiencing them, what's something that we could do to look after our prostate and manage it?
The first thing we've got to do is look at our nutritional intake, so food choices. So fruits and vegetables, how often do we talk about those, Heinzie? And back off saturated fat, look at fish a little more often. But there has been, since the 1900s, a spectacular herb called saw palmetto, which is here. And saw palmetto is the fruit of a particular palm tree called a Serenoa repens that the North American physicians did call the old man's friend. Now, what that herb does is interfere in that conversion process that I just mentioned. So if you can slow down the conversion process, you therefore reduce the risk of the prostate getting larger.
Are there any other natural remedies?
Yes, there are. We've got nettle, which is here. Nettle is the classic urinary herb. And another one that's often combined is grapeseed, because that's an overall protective herb. Now, we've got to remember that when you're about 20, the prostate gland is about the size of a walnut, so including the shell. By about 40, it's the size of an apricot. By about 60, it's the size of a lemon. And that therefore means it can put pressure on the tube, on the ureter, which drains urine out to the body, out of the body. So that when that happens, then there can be those issues that we just went through.
So those that just want to look after their prostate health, or those that might be experiencing those symptoms, these are herbs and things that they can incorporate into their everyday life?
Yes, they can, very simply. And it's the sort of thing that's often brought up by the partner, by the spouse, that's disturbed by the number of visits to the toilet during the night. And they say, well, for heaven's sake, go and do something about it. This is a simple way. Now, enlarged prostate's got a name, it's called BPH, benign prostatic hyperplasia. It's a fairly common thing because of this ageing process. But here is a herbal combination that intervenes in that protection process and the conversion process.
Is there a particular age that people should start taking these supplements?
Look, I think we should all be aware of our prostate, all we blokes, Heinzie, but around 50 is where that hormone transition starts to occur. So it's about 50 that normally we need to be thinking, how am I travelling?
Now, prostate cancer is the most common cancer for men.
Yes.
Is there a link between the two?
No, there's not a direct link. They can sometimes occur together, but just because you have an enlarged prostate doesn't necessarily mean you are at increased risk of prostate cancer. Now, that test you were mentioning before, which is no longer done with the rubber gloves and the perspiration on the upper lip.
Damn.
We have a very simple blood test now which measures PSA, and it's a very reassuring thing to go and have done, which is part of routine testing these days anyway.
Well, mate, we should be looking after our health and our prostate. You are so right with everything you say. Gerald, thank you so much. The A to Z of Vitamins is brought to you by Go Healthy, New Zealand's #1 premium supplement brand, now available in Australia.